Good afternoon, everyone. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At the moment, all participants are in a listen-only mode. For those that are connected by telephone and require operator assistance during the call, please press *0. For those online that require assistance, please use the chat box on your screen. I would like to now hand the meeting over to your host, Jennifer Major, Improvement Lead at CFHI. Please go ahead.
Hi, everyone. Welcome to today's webinar. So I'm Jennifer Major. I'm your host for today, which is the first webinar in CFHI's new discussion series called Community Dementia Care and Support, Innovation Supporting People Living with Dementia and Care Partners Closer to Home. We're pleased to offer French simultaneous interpretation on today's webinar. So if you'd like to see and hear the presentation in French and you've not yet been transferred, please let us know in the chat box on the bottom right of the screen. Once you've been transferred, you will need to shut down your computer speakers and dial the number on the screen. We also invite you to share questions and comments at any point using our chat box in either English or French. We will reserve verbal discussion of comments and questions to the end of the webinar, but feel free to participate in the chat as we go along. So thanks everyone for answering the lobby poll question. I think those results will show just briefly, but our participants for today include representatives from 10 provinces and 1 territory, and a few from actually outside of Canada, so that's awesome. We are joined by representatives of government, regional health authorities, researchers, universities, Dementia Advocacy Canada, and all the people they help us recruit who have lived experience in the area of dementia as either a person living with dementia or as a care partner to someone living with dementia. So welcome to everyone. As I mentioned, representatives from all provinces and most territories, so welcome to today, and also thank you so much for taking time out of your day to come. So before I go any further, I would like to just share a territorial land acknowledgement of where I'm presenting from today, which is in Ottawa, and of my hometown. So this acknowledgement is meant to recognize the traditional territory of the Indigenous people who call the land home before the arrival of settlers. Just a note, my slide isn't changing. So CFHI's head office in Ottawa is located on the traditional unceded territory of the Algonquin and Shinabeg people. My hometown of Corner Brook, Newfoundland, which is on the left, is traditional Mi'kmaq territory. I acknowledge and respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Inuit, and Inuit of my home province of Newfoundland and Labrador, and I'll say that I very much enjoy the land and spending time outside in both Ottawa and Newfoundland. I encourage all of you to share in the chat box the territory and land that you're joining us from today. So I'll just go to the next slide, and just to introduce the CFHI team involved in creating and producing this webinar series includes Tanya McDonald, who's the director of the program and other programs at CFHI, Jessica Fournier on the right, and me pictured in the center. Sheena and Kelly are behind the scenes producing the webinar, and throughout the course of the series you're going to meet many more people from CFHI who are involved in some way. So for example, helping us evaluate our series to make sure that what we're presenting and discussing with you is relevant to moving improvement forward in this area. So I'm going to actually introduce our formal presenters today. So Stacy Johnson is with us, as well as Mary Beth Whiten and Mimi Lowy Young, who are going to lend their expert perspective to the information presented and to the comments and questions that you enter into the chat. So I'm going to turn it over to Stacy to briefly introduce herself.
Hi, everyone. Can you hear me okay?
Yeah, we can hear you.
Okay, great. Hi, my name is Stacy Johnson. I'm the interim manager in the Quality Standards Program at Ontario Health, the Quality Business Unit, formerly Health Quality Ontario. Prior to this, I've been a lead in the program for going on through 4 years, and among the quality standards that I developed was the Dementia Care and the Community Quality Standard, and my background is in nursing. Thanks very much for having me today.
Thanks, Stacy. And Mary Beth, over to you to introduce yourself.
Having me today as well. My name's Mary Beth Whiten. I'm 53 years old, and I was diagnosed with behavioral frontotemporal dementia at the age of 47. I'm the co-chair of Dementia Advocacy Canada. I'm a member of the Ministerial Advisory Dementia Team. I'm a member of the new Alzheimer's Society of Canada's COVID-19 Dementia Care Task Force. I also have just joined the PHAC Dementia Guidance Expert Review Panel, and I'm also a member of the World Health Global Dementia Observatory Knowledge Exchange platform, and I have my fingers in a lot of other pies. And thanks for having me.
Mary Beth, thank you so much. And Mimi, to introduce yourself.
Oh, thank you very much. It's both a pleasure and honor to be here today. I have been a health executive for over 40 years, but most recently I'm coming to this session as the chair of the board of directors of AgeWell, which is a network of researchers creating innovation to support aging well and support for people with dementia, technological solutions, that is, for supporting people with either dementia or for adults living well. I also am the former CEO of the Alzheimer's Society of Canada and was the original architect of the National Dementia Strategy. And as well, I'm currently appointed to the University of Toronto's Institute for Health Policy Management and Evaluation as a senior fellow and adjunct professor. That's me.
Thanks so much, Mimi. So we're surrounded by experts who are going to contribute to the discussion today at a really great level. So really encourage you all to participate in the chat, ask questions to these experts that we have with us, and share your expertise as we engage in this discussion today. So what are the objectives for today's webinar? Well, we're going to provide an overview of CFHI's Community Dementia Care and Support webinar discussion series that we're going to be hosting between now and April of next year at least. The series is going to profile innovations to support people living with dementia and care partners closer to home. We're also going to broaden awareness and discuss Ontario Health Quality Standard and associated resources that are designed to help improve care for people living with dementia and care partners in the community. So we'll hear from Stacey about that shortly. And we'll also hope to facilitate a discussion around the potential spread of standards, but also innovations to improve care and supports for dementia in the community. So looking forward to it. So CFHI, the Canadian Foundation for Healthcare Improvement, just a little bit about our organization. So we're a not-for-profit organization funded by Health Canada, and our mission is to collaborate with partners to identify and spread innovations that improve healthcare closer to home and community in areas of shared provincial, territorial, and federal priorities. So the impact of our work is lasting improvement in patient, family, and caregiver experience and health, work life of providers, and value for money. So we do our work in partnership with patients, families, and caregivers because people with lived experience bring perspective on how quality improvement and innovation will change their personal experience. So that is like a #1 partner that we always have with us. We also partner with health and social services providers, governments, other organizations to make sure that what we're doing at CFHI is adding value to the work that's already being done across Canada. We believe in collective power for change, so partnering with others where we can add value is central to our work and vision. So some examples of what we do: we provide networking opportunities from people from across health systems, communities, jurisdictions to learn from each other. And one thing that we all want to learn from each other is not only what's working well, but also what's not working well. So CFHI does a lot of evaluation and analysis when we get people together to really network and share those lessons learned so that we can share it back. We also support on-the-ground implementation and evaluation of innovations across multiple communities to ensure more improvement for more people. So definitely check out our website. Maybe one of Jessica could probably type in our website address. You can check out some of our programs and also some of the tools that we use to support our work. So So today's discussion is going to focus on how we can better support people living with dementia and care partners in the community, which we know is a federal, provincial, and territorial priority. So pictured on the slide there is the National Dementia Strategy, the first national strategy that Canada has had, and both Mary Beth and Mimi were very much involved in the creation of this. I think we also have some of our the people that we've been working with from Public Health Agency of Canada on the line with us today. So we hope to advance through this webinar discussion series some of what we are doing in the areas of this national strategy to improve the quality of life for people living with dementia and care partners. So we know there's a lot of organizations and people in Canada who already have innovative solutions that can improve experience of life for people living with dementia and care partners. So we've started conversations with many of the organizations pictured on this slide. So I mentioned Dementia Advocacy Canada. We've worked closely with them and others. We've created a steering group who is working with us to review the content and help us analyze some of the main comments and questions that are coming out of this series to make sure it has relevance to people with lived experience. And we want to continue to partner with people who stand to benefit most from the quality improvement in this area. And then we also want to hear from and explore partnerships with governments from provinces and territories to identify where is it that CFHI can add value to spreading innovations in these areas. And the areas that we really will focus on in this discussion series and also in kind of our partnership discussions really is around what can we do to improve timely, compassionate dementia diagnosis and primary care, and how can we improve post-diagnostic support, including coordination and navigation. So the types of innovations we're going to talk about are going to vary. So it can be a model, a program, an approach, or a resource that's really been shown to improve the experience and quality of life, or it can be a new way of delivering care. When I say innovation, I wanted to just make sure that I'm defining what that means. So really we're considering innovation in two different, I guess, ways. So a first type of innovation is what we call an emerging innovation, where that is a promising practice or evidence-based idea that's too new to have results. So we know, for example, from working with people with lived experience or a care partner that they've experienced something, so like a service that has really improved their experience, but it hasn't been in a peer-reviewed journal yet. It hasn't, spread to another jurisdiction or community, but this is something that we should look at. So that's one type of emerging innovation. It has some evidence, not a ton. It's promising. We should have a look at it. There's also a second type of innovation, which we call a demonstrated innovation. So that's a practice that's been implemented and has significant evidence of improvement. So it might have been published in a peer-reviewed journal article, for example. So next, I am going to ask a poll. So you're going to see your screen kind of split into four now, and so we're actually not going to show the results of this poll until later. More about that in a little bit. I'm just going to read the question. So do you know about an emerging or demonstrated innovation that can be spread across Canada that will improve timely, compassionate dementia diagnosis and primary care? So yes or no, or you can choose not to vote. A second question is, do you know about an emerging or demonstrated innovation that can be spread across Canada that will improve coordination and navigation of post-diagnostic care and support? If you answered yes to either of those questions, tell us if you think that innovation would work to improve care and supports for people living with dementia and care partners in the current COVID-19 context. So what's going to work virtually, what's not going to work virtually, and how can we help solve any problems or barriers to implementing and spreading those? If you answered yes to any of those questions, just tell us if you can about the innovation. And if you don't have time to talk to mention it, fully here, hopefully we can discuss it later in the discussion segment. So while you're answering those questions, I'm going to turn it over first to Mary Beth, Mary Beth, for you to just briefly comment on why you think spreading innovation in the area of early diagnosis and post-diagnostic support is so important right now. And, you mentioned you're on a committee that's really looking at COVID-19 and how innovation can be spread in that, in this current context. So just some of your reflections on that issue.
Thanks, Jennifer. It's a really important question. Spreading innovation in the areas of early diagnosis of dementia and the post-diagnostic supports in the community are critical in helping people live well with dementia. If we aren't presented those types of opportunities, information, suggestions, the person living with dementia can walk away from a diagnosis not understanding and realizing their true full potential that they may have over the course of the rest of their life. And as far as the COVID-19 pandemic, can we support this involvement or improvement? The answer is absolutely yes. I'll try and keep it short. But first of all, we don't have a choice. Considering the conventions on the rights of persons with disabilities, we must continue this important work, whether we're in a pandemic or not. And so the rights of people living with dementia are very important. And the other piece to that is there's a lot of different task forces that have been incredibly quickly pulled together to take a look at these different gaps. And they're very nimble, and they're coming up with really incredible solutions. So can we do it now? Yes. Back to you.
Thanks, Mary Beth. And yeah, I mean, I definitely echo your response in that, optimizing quality of life for people living with dementia and care partners, it's not really you have to. So I'm glad that you could share that with us, and looking forward to discussing more. Mimi, what about you? What are your thoughts?
Absolutely. But I'd like to add a bit more to the point. I think COVID-19 has pulled what I call the Band-Aid off the health system, and has really shown some real issues that we, as healthcare providers, policymakers, researchers, need to really look at quite seriously. I think some of it is attitudinal. We have a huge issue of ageism. We need to break down those barriers so that we can ensure that these innovations that we're going to be talking about and listening to really can be adopted and adapted to the various parts of the system, both from the early diagnosis and then to the support services. But how we need to say that the virtual environment, yes, can help, but in some instances it won't. So we'll need innovations to be able to fill in for where we cannot do it virtually, and find new ways to do things. But I agree with Mary Beth, there's a lot of good stuff happening right now. And I think, I like to call Canada Pilotville, and I think we need to get beyond that and need to really recognize that there are some true innovations that can be adopted and adapted quickly, and so that we can really make a difference now and not wait until everybody's satisfied, but move forward and have these innovations implemented without people saying, but we're different, and really recognizing that probably that it can be spread farther and deeper into the system to really make a difference.
Great, thanks, Mimi. Okay, so I mentioned the poll response. So we're going to actually bring the results of that poll up a little bit later in the discussion so that we can reflect on what has been shared. And I invite everyone to just in the chat, respond to what you heard Mimi and Mary Beth talk about in terms of COVID. So, what is going to work in a virtual environment? What's not going to work? How can we make sure that Canada is not a land of pilot projects? CFHI is certainly committed to that, but what is it that we can do to make sure that we spread innovations in this area? So I'll just move on to the next slide. And then we're about to introduce Stacey over. So I'll just mention briefly how we found the innovations that we're profiling in this webinar series. So we have reviewed published literature to identify primary care models of dementia care. So the University of Ottawa and Briere worked with us on that. We consulted people living with dementia and care partners, including through an experience survey that we distributed with Dementia Advocacy Canada. We had discussions with many provincial and territorial dementia leads, researchers, organizations, governments, and we also worked with the creators of innovations to write executive summaries of the innovation. So starting on our next webinar, we will be sharing executive summaries of innovations that will be profiled. So stay tuned for that. So for your consideration for today and throughout the series, we are hoping that you'll tell us about other promising innovations in Canada that we can consider for spread and to profile in this series. What's the interest and readiness and feasibility of your organization, community, government to implement and spread innovations in these areas? And where can CFHI add value to support the spread of those? And we also want to know, and this is going to be a question at the final survey after all the presenters and discussions over, will there be value in creating a community of practice to support continued knowledge sharing about the innovations in this series? And again, what are the partnership opportunities, which I've mentioned? How is it that CFHI can work with all of you to make sure that we're adding value to what's already being done? So we have a web page, which the website address is right there on the slide. So you'll be able to go get information about all the upcoming webinars, or at least some of them. The dates, I think, are all there. And over time, we're going to be populating that with any of the resources, links to different web pages, etc. So for today's quality standard, we'll link to the quality standard right on that page. So I encourage you to go have a look, and you'll see if you've ever been to the CFHI website. We have a brand new website, and it looks great, in my opinion, for sure. So check it out. So this is the webinar series dates just here in this timeline. So as mentioned, you'll see that on the webinar website page as well. So there's the next one, July 21st and September 15th and October 20th. I won't get into it. Also the registration link that you can share with anyone is right there. All right, so I'm going to introduce, turn it over to Stacy now for your presentation. And I think, Stacy, the first thing might be a poll, like fairly soon after your presentation.
Yes.
Or you get into it, yeah.
Yes. Okay, thanks so much. So I'm going to speak to you for the next little bit about the Dementia Care in the Community Quality Standard. Well, it was created here in Ontario. You'll see based on the methods that we use and the content that's in there that the content will resonate with a lot of people from across Canada as well as internationally. And I'll get into a bit more detail about why that is. And just when we talked about, when we started and we were speaking about, timely and compassionate dementia diagnosis and primary care and coordination and navigation of post-diagnostic care and supports. This really does align with a lot of the content that's in the quality standard. So as we go through, I'd like to focus on how this might also apply to where you are and the people that you serve. So, but before we jump into the content, we will start with a poll. So if we go to, do I have? I will ask to get a sense from people, what have you used or ever heard of Ontario Health, formerly Health Quality Ontario, quality standards? So if you can put in your vote. And so it looks like 2/3 of people have and 1/3 have not. And so we'll show the results. So it says 65% of people have heard or used quality standards, and 35% have not. that's helpful for just to get a sense of the people in attendance, what your knowledge is of quality standards. So just to jump off, just so that we're all sort of on the same level, same playing ground, is I'm just going to give you a brief overview of what quality standards are and what they aren't, and really just it provides some context for when I go into describing the quality standard. It gives you sort of a sense of like, oh, okay, it sort of gives you understand where it sort of situates itself with everything else that's out there. So quality standards are a concise set of high-impact statements that describe high-quality care where identified quality gaps or variation in care exist. Quality standards outline the what of care that should be delivered, but are agnostic to who should be delivering the care, which addresses some of the regional variation because how care is delivered in one part of the province or territory may vary, and not everyone will have the same amount of resources, but it really tries to focus on what is the care that should be delivered. They all are voluntary and they are aspirational, and they include between 5 and 10 strong evidence-based statements that focus on priority areas for improvement. And so when we think about, so we really try to conceptualize these as sort of raising the ceiling with the goal of having people receive the highest quality of care regardless of where they live. So often there's a lot of, most common question we get is, how is this different than a clinical practice guideline or a professional standard? And really they're meant to be, it's complementary to what is already out there. If anyone has read a clinical practice guideline, there's many recommendations. It could be 100 or more pages. And if you are going to be focusing your quality improvement efforts, it's where do you start? And then professional standards, so I'm a nurse by background, so our professional standards really are about what are the minimum standards, and they're specific to this particular professional. But when you have a condition or you focus, the quality standards, they focus on a variety of clinical conditions or topics. So I'll be speaking about care for people living with dementia in the community and their care partners today, but we have a variety of topics from mental health and addiction topics, diabetes, delirium, heavy menstrual bleeding, palliative care. And sort of as I mentioned, quality standards focus on priority areas for improvement. Our evidence source are clinical practice guidelines. So they are, when we talk about the quality standard, it would align, the things that are in there would resonate with you regardless of where you live. So here, I've actually really just already covered that. So we focus on topics where there are large variations in how care is delivered or where there are gaps in care between what the care people receive and what the care they should receive. And as I mentioned, they're grounded in the best available evidence. For each quality standard, there's a suite of resources that accompany the quality standard, and this is really to help support the uptake and implementation of the quality standard. So there's the quality standard, which so you know what quality care looks like and is based on evidence and is informed by our expert consensus, which is our Quality Standard Advisory Committee, who I'll speak to about in a few moments. There's the recommendations for adoption. These are system-level recommendations that can help support the uptake of the care that's outlined in the quality standard. So sometimes they are at the regional, the ministry level. These help to support the uptake of the quality standard, because sometimes, if we want to deliver this the highest quality care, but sometimes there are systemic or system structures there that can actually help make it really hard to do the right thing. There is the patient reference guide, and this is a plain language summary of what's in the quality standard, and it helps and supports people to have conversations with their provider about their care, or for their family members to have conversations as well. There's the Getting Started Guide, which is a quality improvement tool, includes quality improvement tools and resources for providers and organizations, and includes action planning templates. So those would be, we have those for It's general and it actually can apply to any of our quality standards. There's the infographic, which really is the platform for why is this quality standard needed? What is the variation in the care that's outlined in the quality standard? Why? So it really helps to support and inform resource planning and improvement efforts. There's the measurement guide, and that is in the quality standard, there's a suite of indicators that accompany each statement, and it really is to support implementation and improvement efforts. So if you are going to implement a statement, how do you know you're actually making an impact? Are you getting the result that you had hoped? Is it being implemented as it's supposed to be? So here we've just pulled out one particular statement. So the quality. So this for each quality statement, this is what comes with each one. So if you open up a quality standard, so there's the statement. So it's written from the patient perspective. It's concise. It's action-oriented, and it focuses on clinical processes and what a person should expect as best possible care for the condition or clinical area. There's the audience statements that accompany this that outline what the quality statement means from the perspective of a person living with dementia for clinicians as well as for health system planners or health service planners. This is accompanied by as well as definitions that provide additional context or explain the concepts that are included in the concise quality statement. So in order to keep things really brief in the statement, and also to make sure, because my definition of what should be included in a comprehensive assessment and also what someone else might think, oh, they might actually be different, and that's sometimes where the variation in care might come from. And as I mentioned before about the indicators, for each statement there are a set of quality indicators that accompany the statement that support, so those include structure, process, and sometimes outcome measures that are meant to allow people to implement the quality standards and to measure this implementation. So as I mentioned, the patient guide, it's just a bit more detail there, is designed to give people information about what quality care looks like for various conditions. It's based on the best of evidence. So it's a plain language summary of what's in the quality standard, and can help to inform conversations, provides conversations with your provider. And these have evolved over time throughout the evolution of our program, and now they're actually they're a bit more focused in sort of some of the content and provide so this was a few years ago that this quality standard was developed. So as this gets refreshed in the future, the resources will continue to evolve based on the feedback that we received. And so we also have Quorum. So Quorum is an online community of practice that's dedicated to improving the quality of healthcare in Ontario. In the Quorum post, is a series for quality standards adoption. It highlights the improvement efforts across the province related to specific quality standard topics. And Quorum is accessible to people from across Canada. You can find, there's a link there in the slides, but if you Google, Health Quality Ontario Quorum, you can find it there. So just to summarize, quality standards are for quality improvement purposes. They're a concise set of action-oriented evidence-based statements. They inform quality improvement efforts and for the goal of reducing variation and to address gaps in care. It includes a suite of products that can help support the implementation of quality standards. So for quality standards for the dementia care and the community quality standard, I'm going to now explore this in a little bit more detail to give you just a sense of what the quality standard covers, its development, and the statements that are included. There we go. So at the heart of our development process for a quality standard is the evidence, so is the clinical practice guidelines. So here this picture just really depicts what the evidence sources are for quality standards. And in the heart of it is the clinical practice guidelines and health technology assessment, so where that's applicable depends on the quality standard topic. And surrounded by this is we're not just only going by the clinical practice guidelines, which can be international, but it can also be Canadian, but it's informed by our Quality Standard Advisory Committee, which is, we recruit a committee of, with 25 people, lived experience advisors, clinicians, researchers, and administrators on a voluntary basis that help to inform, what are the biggest quality gaps, how, and also with the writing and really providing the context and description that it resonates with the people of Ontario. Supporting that is also, in addition to the 25 people, we do interviews, surveys, and consultation with key stakeholders to inform the content as well as the adoption of the quality standard. And our quality standard is, all of our drafts are posted online for public feedback for a 3-week period to get information, to get feedback on the quality standard as well as the patient guide, to say, are these things resonating? And do we have any feedback? Is the language right? Does this resonate with folks? And then we go through that with our committee we go through every single comment we receive, and then we work with our committee to address that feedback. So we do get a broader perspective on the quality standard. Take a sip of water there. Okay. So as mentioned, the Quality Standard Advisory Committee, these are, there's an advisory committee for each quality standard topic so that we have the right experience around the table. So we have lived experience advisors, and we have a variety of clinicians and providers and service providers that help to inform the quality standard. And it was chaired by Dr. Linda Lee and Jane McKinnon-Wilson. So the Dementia Care in the Community Quality Standard, so the scope of the quality standard is influenced by the clinical practice guidelines, so that the evidence that we use aligns with what the scope of the quality standard is, so that we aren't misrepresenting what the scope is for the quality standard. So it would include care for community dwelling people living with dementia, including the assessment of people suspected to have dementia or mild cognitive impairment. It applies to a variety of settings, as I've outlined there, and then also provides guidance on support for caregivers, given the critical role that caregivers or care partners provide. There we go. There's a little glitch in the slide there, but so here we've outlined on the next 2 slides are the 10 quality statements that make up the quality standard for dementia care in the community. And you can see when we go through this, so quality statement 1, comprehensive assessment and diagnosis, as I mentioned at the start, and then as we talked about at the beginning of the session, the importance of having timely diagnosis and comprehensive assessment. There's interprofessional care team, individualized care plans, named point of contact. And the ones that are circled in red, I'm going to go into just a touch more detail, just to give you a bit more of a flavor of the content. And as I briefly go over the quality statements, I'd ask you to consider what the quality gaps or variation that might exist in your own jurisdiction. As I said, this is built in Ontario, but I'd imagine, and I'd love people had any reflections as we go through this. Does this resonate with you? And would these things apply in your jurisdictions, or would these be quality gaps that you might see within that people might experience in your jurisdiction? And the next, so these are the rest of the quality statements. So education and training for people living with dementia and their caregivers. There's education and training for healthcare providers, access to support services, caregiver assessment and support, safe living environment, and access to primary care. So as I go, I'm going to as I go through the next, as I mentioned, the ones that are have the box around them in red, I'm going to go into a little bit more details. But I ask people as we go through the next few slides, pardon me, to enter into the chat the names or links to any tools or resources that you know that can support these quality statements. Because as I mentioned, these are the what, but sometimes and the how these are delivered, these innovations that are needed to implement these things, those are really key things that will be great to hear from people here, because I imagine a lot of these topics would resonate with people on the call, and as we're developing and sharing resources with this group, it would be really great to hear what tools or resources you know that could support this quality statement. So, as I mentioned, quality statement 1 is about assessment and diagnosis, and the statement it says that people suspected to have mild cognitive impairment or dementia receive a comprehensive assessment when signs are first identified. If diagnosed with either condition, they are then reassessed on a regular basis or when there is a significant change in their condition. And we have regular basis because that, what would that mean? And just knowing how that could, my definition or someone else or wherever you are in the province, it could vary. So in the quality statement in the definitions, we have what the definition is. And then for examples of tools, so when we relate to comprehensive assessment, there are some examples there of, Mini-Mental, 6CIT, and then there's some other resources there. So if you do have any examples of things that, would feel that tools and resources that would help support the implementation of this, please do include this. And it doesn't have to be Ontario specific. Wherever you are, that would be great to know what you are doing. And then individualized care plan. So once people are diagnosed, that they have an individualized care plan that guides their care, it identifies their needs and those of their caregivers and goals, and that it's not enough that it's just at one point in time, that it's reviewed and updated, and that as people's needs and goals and those change, that the care plan reflects that, and that it is an ongoing conversation. And as I mentioned in the definitions, this in the quality standard itself, it has a full list of components of things. For example, needs and preferences and goals of care, nutritional care planning, and things like that. So that has a bit more detail in there. And then it also, what does regular basis mean? So we had it as every 6 to 12 months or sooner according to clinical need. Access to support service, we know is a critical thing, that people living with dementia have access to support services that are individualized and meet their ongoing goals and needs, so that they evolve as people's ongoing needs and goals change. And there's just and tailored to their changing physical, psychological, and social needs. So it's not just only the physical, it's thinking about the person more holistically. And then caregiver support, assessment and support, that people are assessed on an ongoing basis and offered supports to address their individual needs. So this includes at a minimum assessment of their emotional, psychological, and social needs. So there's one, for example, one scale that can be used is the Kingston Caregiver Stress Scale. So that's just a brief summary of the quality statements, and as I mentioned, there's a variety of topics in there and that were identified as being high priorities for improvement in the province of Ontario. And as I mentioned, they cover the content that's in there comes from clinical practice guidelines with the expertise of our committee, because sometimes there are things that the details are not in those clinical practice guidelines, or actually the context of where we live may influence things in a little bit different way, just to how maybe care might be set up. So to support so we have the quality standards of the what, but then there's the quality standard resources that can support implementation, uptake of the quality standard. So we can provide, so these include the Getting Started Guide, as I mentioned earlier. There's also the Patient Reference Guide, which can help support conversations between the person and their provider. There's also Quorum, the online community of practice. and there's a specific series on dementia care in the community. And then, I've just linked there to our other quality standards topics. And then if you do have any questions about this or any other quality standards, there is the quality standards email there. And I just want to acknowledge and thank all the people that were involved in developing this quality standard. Quality standards take between 15 and 18 months to develop. So we had a lot of participants and feedback from stakeholders from across the province that helped to inform this content, and also a lot and so much work and dedication from our Quality Standard Advisory Committee, which was chaired by Dr. Linda Lee and Jane McKinnon-Wilson. And so just wanted to, a special thank you to them for their volunteering to develop this with us. So that's it for my presentation.
Thank you so much, Stacey. That was an excellent overview of the quality standard. And I know there's been a lot of questions and comments coming in that we're going to get to very shortly. But I guess right now what we're going to do is we're going to see a slight change on the screen as we move from the formal presentation in our breakout room to our discussion segment. So a reminder to the French participants to ensure your computer speakers are now muted, so that you do not also hear the English audio. So just, again, the French participants, ensure that you just take a moment, mute your computer speakers so that you don't hear the English audio. So just before we get into the discussion segment, we're actually going to do some polling right now. So we're going to ask 4 polling questions, 2 of which are a follow to Stacey's presentation. We're not going to discuss you'll see, I think the poll results will be published, but Stacey definitely, and Mimi and Mary Beth definitely take note of kind of what you're seeing, and I'll make sure to remind kind of what the polling responses were. But then we're going to move on to the results of our previous poll, as well as 2 additional questions. So just to give people that kind of heads up. So the first 2 questions we want you to answer, so which of the 11 quality statements, or I guess, yeah, from the quality standard for dementia care for people living in the community would most improve care and supports for people living with dementia in your community? So choose your top 3. So, and if you don't want to answer, I mean, we didn't give a ton of information on all of those, so definitely understand that. But if you read through those and you think, you know what, definitely, like, those are what we think should be moved forward on. So the first one is comprehensive assessment and diagnosis, interprofessional care team, individualized care plan, or named point of contact on a care team to facilitate care coordination and transitions across settings. Education and training for people living with dementia and their caregivers, education and training for healthcare providers, access to support services, caregiver assessment and support, safe living environment, access to primary care, or you prefer not to answer. And the second question is, which of the 11 quality statements from the quality standard for dementia care for people living in the community could you most feasibly implement in your community right now, given the COVID-19 context? So choose your top 3. Is it comprehensive assessment and diagnosis, interprofessional care team, individualized care plan, where there's a named point of contact on a care team that can facilitate that care coordination and transitions across settings? What about, or is it education and training for people living with dementia and their care partners, education and training for healthcare providers, access to support services, caregiver assessment and support, safe living environment, access to primary care, or prefer not to answer? So I'm going to say also that one of the things that CSHI is going to do after this webinar is we are going to look at the polling results, analyze them, and make sure that we show you what the results were on our next July webinar. And we'll also do a post-webinar email with kind of some of the main results. So we will be kind of discussing more in full on our next webinar, as well as we'll follow up with you through that email. So now we'll go to the next question. So the next thing we're actually going to do is earlier in the webinar, we actually asked you about do you know about emerging or demonstrated innovations that can be spread across Canada right now to improve timely, compassionate dementia diagnosis and primary care? And we had 44 respondents saying yes and 56 saying no. We asked, do you know about an emerging or demonstrated innovation that can be spread to improve coordination and navigation of post-diagnostic care and support? And 39, almost 40% said yes, and 60% said no. So we're really hoping to change that through the course of this webinar series, where we hope you all continue to come to these webinars and we get a yes for 100%, because we know that there are innovations that work in those areas. And so another question that's going to be relevant for today's discussion is, if there are innovations, if you answered yes, would they work right now in the current COVID-19 context? And so 71% said yes, 28% said no. And I know Megan in the chat, Megan O'Connell, who's with the Canadian Consortium of Neurodegeneration and Aging, she had mentioned that they have remotely delivered psychological interventions, which are really good innovations right now. And they're right now delivering those during COVID, but cannot reach as many rural families as they would like, because many people do not have in-home broadband internet or computer, tablets, or smartphones. So what are those problems, and what are the solutions to issues like that? So I see that people also have inputted some specific examples of innovations in these areas. So as I mentioned, we're going to make sure that we analyze those and share them back. But Memory Clinic is one. We have the Quebec Alzheimer's Plan has some innovations. E-consult, remote interventions in the CCNA Team 15. So that's what Megan O'Connell, I just mentioned Megan O'Connell had chatted in some information, and we're going to profile innovations from there during the course of our series. Okay, so I'm going to move on to the next poll so that we can get on with our discussion. So the final poll that we have is what is the readiness and feasibility of your organization or community to implement innovations or solutions to improve the timely, compassionate dementia diagnosis and primary care right now? So again, given the COVID-19 context. And I mean, some of that obviously is going to depend on what innovation it is. So throughout the course of the series, we're going to ask you the same question, but it'll be attached to a specific innovation. So on our next webinar, for example, we're going to talk about an innovation that's worked really well to improve early diagnosis and post-diagnostic support in Alberta. And so when we ask that question during that webinar, you're going to be more easily able to probably judge the answer, but thank you for responding to that. And then the second question is, what's the readiness and feasibility of your organization or community to implement innovations or solutions for coordination and navigation of post-diagnostic care and supports right now? So we're seeing for both of those answers, medium is the highest. So there's almost 50% saying, we're ready to implement innovations that support early diagnosis. A little bit less on the ready to implement innovations that support post-diagnostic support. We know that both of those things should go together as much as possible. Like getting an early diagnosis, you'll want to also provide that post-diagnostic support as part of that. So how can we do that together? So thank you for your responses. So let's move on to the discussion segment now. So first, there were some questions that came in for Stacy specifically. So Stacy, maybe I'll ask you one of the questions that came in, and if we don't get to all of them, then we'll follow up by email. So let me just check. So are you aware of other quality standards in dementia, and how does the Ontario ones compare to those? So the person who asked the question was not aware of any other Canadian ones, but knows that NICE in the UK has put out some recently.
Yes. So in Canada, there are not, we haven't there's no quality standards produced by other jurisdictions. We have spoke with other jurisdictions. People have heard about our program, and so we've had conversations. So people, they're interested in learning more. But our initial program was actually built off the NICE program in the UK, as well as Australia has a form of a quality standards program as well. So we use, so NICE, they have very high quality clinical practice guidelines. They are based in the UK, so there's some context things that we need to consider. But that was one of our evidence sources for the clinical practice guideline. I mean, their clinical practice guideline was one of the evidence sources that we use for our quality standard. And also their quality standard may, some of the things I can't remember all the details of it, but they may align with some of the stuff that we have in our quality standard. But there's also some nuances because there's the contextual piece that relates to what our Quality Standard Advisory Committee identified as being the priority areas for improvement in the province. So that's why our quality standard would vary because those are the things that we highlighted, but the evidence sources would actually be quite similar.
Okay, thanks, Stacey. So maybe I'll ask you one more, and then I'm going to turn it to first Mary Beth and then Mimi, just to see if you have any comments on the COVID, the questions around innovations in these areas. So there's like a 40 to 50% readiness right now for organizations to look at this, or any other thing that you've seen in the chat. So Stacey, another question for you. So how do the quality indicators from Ontario align with Accreditation Canada standards?
So they are different. We do look at what are also assessed, but because ours are trying to assess the implementation of a specific quality statement, they will differ, but we also have measures that are, and these have evolved over time because we've gotten feedback from people in implementing the quality standards. We do have indicators that actually attempt to measure the overall impact of the quality standards, so those can be more broader measures rather than statement specific, that really, because the statement specific ones are really about on the ground, how are you going to implement, how will I know that I had an impact on and did what the statement is intending to do. So it has a different purpose, but we do try, especially for the outcome indicators where it's not the overall measures of success of the standard, we try to look at and see, are there things that our people already measuring, because we know there's a lot of fatigue when it comes to measurement, and we don't want to contribute to that either. So there's definitely considerations, but I think the intent of the measurements are different, but we do try to see where we can in just generally about the measurement, and we try to, our newer quality standards, we've actually have a much shorter list because of the fatigue we've heard from end users.
Okay, Stacey, and there is one more question we didn't get to. I'm not sure if you saw it in the chat, but maybe Jessica, if you can just add that other chat into the question for Stacey into the chat. Maybe Stacey, you could take a minute and just answer it in typing. So Mary Beth, what do you think about the discussion, some of the comments that have been shared from today's webinar? Oh, if you just unmute your phone. Can't hear Mary Beth, so maybe Mimi, do you want to respond to something you've heard today?
Yeah, I think it's very interesting. I think it's somewhat promising because I think we have to move from the what to the how, and obviously that's what CFHI is trying to do in terms of spread and scale. But I think there's still some gaps, and I think we have to look at opportunities rather than looking at them as challenges. But I think there is, when you look at the people that are on this call, there's, I think, a real opportunity to come together and really figure out how the things that we talked about can really impact both the assessment and delivery of services in a coordinated way. despite the differences in the various provinces, I think fundamentally the underlying principles are there and need to be looked at.
Thanks, Mimi. And do we have Mary Beth back for the last word?
Am I in?
Yes, you're here.
Oh, you know, this is a really great example, actually, of technology and innovation, right? This is really cool stuff, and isn't it, here we are. And yet, as a person with dementia, I don't know how many times I've been told, okay, this is what you got to do. And yet, did I follow it? No. So I think it's a reflection of the importance, truly, of why people living with dementia need to be a part of this conversation. So I think that was kind of a good demonstration of where we can provide input. So I think today's comments and conversation is really a reflection of where we sit today in Canada. And I was going through some things, and at the risk of sounding like a little bit the way I don't want to sound, but this is just a reminder. Dementia is the only condition in the top 10 causes of death without a treatment to prevent, cure, or slow its progression. And if we just take a minute to pause and think about that, I don't know what else can help motivate a nation to stand behind that and say, this is where we're at. We know where we need to go. And really, these are the steps that we need to get there. So we need innovation to help us conquer that, right? And as far as the innovation goes, we have to be quicker at it. We know that for a fact. I think there's a 17-year gap, help me out for those who know this number, between the beginning of the innovation till the very end of the innovation. So 17 years. Well, most people with dementia, from the time of diagnosis to death, they're not going to live 17 years. So if we start off with one innovation and I'm diagnosed, I'm probably not going to see it. So, there's some humbling, I think, facts to help us remind ourselves this is important, and we don't have time to waste. And we need people to step up and say, this is something that's working. Let's take a quick look. And maybe we need to be more creative at, do we really need to go through that entire 17 years of a process? Like, I don't know, I'm not a scientist, but is there a shorter way that we can say, you know what, this is, as Jen, you said, a promising practice. Let's take a look and get things moving instead of kind of waiting to the very end. And, Stacy has some excellent guidelines to help us get there. Those, statements are so important. Because if we can reach those statements, then we know that we're on the right way. And I'll just, throw one more thing. It's so incredibly important that we do this quickly. COVID shows us that we can do things quickly. It's proven that. And so I really think the time is now. It's opened up some opportunities. As Mimi mentioned earlier, that things can be done, and they can be done now. So let's get at it.
I love to get at it. And CFHI, definitely, I think one of the things that they do is we do spread emerging innovation. So really looking forward to, continuing this conversation with all of you. So we are out of time, unfortunately. So next time we will promise to try to keep the discussion segment longer. It's always a challenge. So thank you for bearing with us this first time. We've gone a bit over. We haven't had enough time for discussion, but really hope now that you have a good basis of, understanding and what we're trying to do here. So I think we're going to now bring us to our kind of evaluation questions. So we have 4 things that we want to ask you today to just help us improve what we're doing here. So I think the screen is going to change. Yes, CQI. So if you can just tell us overall if you were satisfied with your webinar experience, Will you be able to apply what you learned from this webinar in your workplace? And a reminder, too, to check out our webpage for the Community Dementia series, because you'll be able to find a link to the health quality standards that we talked about today, so you can go and consider if you can use those. Will there be value in creating a community of practice to support continued knowledge sharing about innovations in this series? And do you have any other comments or suggestions, including if you're from, for example, a government department or a community organization, how is it that CFHI and we all can work together to really help spread innovations in these areas and learn from each other? So I'd really like to thank our speakers for today. Really look forward to having Mimi and Mary Beth come back to our next webinar to engage in more of a discussion. So like I said, we'll make sure that we have more discussion time on the next one. And we will be sharing back all of the results of the polls and the questions and comments that we had from today that we weren't able to get to. So thank you so much for sending all that in. Encourage anyone that from your network who might have interest to come to this series to register. So the registration link, maybe Jessica can just put it in the chat once again. And I think maybe what I'll just end on is, in the National Dementia Strategy, it says in there that, the strategy was really developed so that we can get closer to the vision of a Canada where all people living with dementia and caregivers are valued and supported, quality of life is optimized, and dementia is prevented, well understood, and effectively treated. And so we want to talk about how we can do that through this series, and really look forward to continuing the discussions with you. So enjoy the rest of your day. Again, apologies for going a little over time, and we really look forward to hearing from you either through email and also just for you to participate in our next webinar. Thanks, everyone.